This is Jenna Nikina on eyesurgeontalks, and this is another questions from patients edition. So this question gets posed to me all the time, and pretty much all the working patients who come in for surgery end up asking this, and that is, how long do I take off work after my operation? So, few things around this. First of all, modern eye surgery tends to be pretty comfortable. Recovery tends to be pretty quick. You can usually expect the vision to be a little bit blurred, even in a routine cataract operation, for maybe a few days afterwards and gradually improving. In a retinal operation, you may have a gas bubble in the eye, so you may not see out of the eye for a few weeks. It'll be very individual. But ultimately, if you have good vision in the other eye, I usually try and tell the patients, look, try not to limit your life, because unless you have very specific post-op instructions, such as posturing after surgery, you can pretty much get on with your normal tasks, including working, if you are feeling up to it. Now, if you have a desk job and you're looking at a computer, you may well feel that you can go back to it very soon after surgery, maybe within days, quite easily. Some people will get a bit more discomfort, a bit more glare from bright lights, and may not feel up to it. There are other operations where you're doing more intensive post-op care, for example, retinal operations with posturing, or operations that require lots and lots of drops afterwards, or lots of hospital visits, and it may be more practical to take a week or two off. And certainly if you're doing jobs where there's a lot of dust or a lot of steam, then that is probably better off being delayed by a couple of weeks to give the eye time to fully settle before you go into those high risk environments where the chance of getting an infection after surgery may be greater. But play it by ear. Ultimately, there's no harm to the eye itself from using it, from looking out of it after surgery, and the recovery usually proceeds smoothly with some post-operative drops and following your advice after surgery.